mynews.studio.
A surgeon in Florida is guiding robotic arms in Angola, performing cancer surgery across continents. The question is, could this shift how global healthcare works from now on?
Today is August 3rd, 2025. Let's take a closer look at that scene. A surgeon in Orlando, Florida, sitting at a console while his patient is on an operating table nearly 7,000 miles away in Angola. Can you describe what this actually looks like in real time?
Dr. Vipul Patel, working from the Global Robotics Institute, used a high-speed fiber optic link to control a robotic surgical system in real time. His patient, Fernando da Silva, had prostate cancer. In Angola, prostate cancer has a high mortality rate, and specialized surgery is hard to access. There was a local medical team on standby, but Dr. Patel performed the main operation remotely. This was the first FDA-approved transcontinental robotic surgery.
So the robot was physically in Angola, and Dr. Patel was controlling it from Florida. For this to work, the connection must be extremely fast. Any delay could be dangerous, right?
Exactly. That's actually one of the main challenges in expanding this approach. The system depends on a reliable, high-bandwidth internet connection with very low latency. They had a backup surgical team in Angola in case of any technical failure. In this case, the operation went well, and Da Silva's recovery is being monitored locally. The wider goal is to gather data and make telesurgery available in more places. But can this really become routine in rural hospitals? And not just for rare cases.
That's what many are hoping for. Hospitals in underserved regions could tap into world-class expertise. Local teams could gain training and, in emergencies, get expert help quickly. But the basic infrastructure, fiber optic lines, reliable robots, contingency planning, has to be in place first.
And how patients feel matters too. For some, this technology is a beacon of hope. But there's also uncertainty. People are asking, is a remote surgeon as safe as someone in the room? And how do local providers adjust to this change?
Training is crucial. Local teams need to understand the technology, and trust has to be built with the community. There's a bigger issue too. If only some regions can afford this, does it narrow the healthcare gap or actually make it wider?
That's where collaboration and investment come in. In this example, Advent Health isn't just offering surgery. They're helping Angola start a national prostate cancer screening program. That means earlier diagnosis and more access to care. But let's shift gears. While surgery is overcoming distance, diagnostics are evolving rapidly as well.
Right. In May, the FDA cleared the first blood test designed to help diagnose Alzheimer's. Before this, diagnosis meant costly PET scans or spinal taps, which aren't feasible for most people, especially in less resourced settings. Now, with a simple blood draw, doctors can detect Alzheimer's biomarkers. Could this lead to earlier diagnosis and treatment for millions?
That's the idea. For Alzheimer's, it's estimated that 3 out of 4 symptomatic patients worldwide aren't diagnosed, often for years. These new blood tests could help close that gap. The same thinking is being applied to cancer. The Vanguard study, which just started, is testing blood tests that can detect multiple cancers at once. Imagine screening for several cancers like bladder, breast, colorectal, prostate, all from a single sample.
That would change routine checkups. For example, Roche's Alexis p-tau217 test for Alzheimer's is said to match the accuracy of PET scans, but is much easier to access. The next questions are, how quickly can these tests be scaled up, and will they reach the places where they're needed most?
There are still challenges: getting approval from regulators, training staff, covering costs, and once again, gaining trust from both patients and healthcare providers. But the potential benefits are significant. Early detection, timely intervention, better health outcomes, and more diverse clinical trials.
And there are ethical and regulatory questions that can't be ignored. When you perform surgery remotely or use new diagnostic tools across borders, whose laws apply? What about data privacy, or who is responsible if something goes wrong?
Global health organizations are working on shared guidelines, technical standards, ethical frameworks, patient consent, and access rules. The goal is to ensure that as these technologies spread, they do so responsibly and fairly.
So, to sum up, we're seeing remote robotic surgery make expert care available in places that never had it before. Blood tests are making early detection possible for Alzheimer's and multiple cancers. The real challenge is scaling these innovations, building trust, and making sure no one is left behind.
These developments aren't just about technology. They're about who gets access, how fair the system is, and what healthcare will look like in the future. The stakes are high, and the questions are pressing.
Thanks for joining us. This episode was brought to you by mynews.studio. Give it a try now, free of charge.